The United States has 5% of the world's population, but we have 25% of the world's prison population. And in large part, that's because we have essentially criminalized mental illness.
What we did was we only moved people out of the old asylums and into the new asylums, our jails and prisons. The real indictment in our country is on us. That's where the real indictment, that we in this brilliant country of ours has not figured out a better way to treat and help those with mental illness and addiction other than to lock them up.
Counties spend $70 billion a year on our jail systems. $70 billion a year. And if you think about it, the prison system houses about 2 to 3 million inmates a year. We house over 11 million inmates who come through our county jails every year. That's the burden that's placed on local government.
And this battle won't be won in individual counties. We need a national movement to reduce these numbers and to change the way we treat people who have mental illnesses. Stepping up provides the vehicle for counties to share information and to share our experiences with each other so that we can learn from each other's successes and also replicate strategies that have already been proven to work.
It's about putting a team together. It's about getting good prevalence data, the numbers of people with mental illness in the justice system. It's about knowing the capacity of your mental health system, then developing a plan, implementing it, and tracking progress. Those are 6 steps, and what we're focused on are counties working in partnership with state governments, passing resolutions, embracing these steps, and then watching county after county, with the support of their state, actually embrace those resolutions and these 6 steps that we're talking about.
We are here to step up and acknowledge that the current system does not improve public safety. And we are here to step up and acknowledge that the status quo hurts people, it hurts families, and it hurts communities. We can and we must do better.
Today we have medications, we have cognitive behavioral therapy, and many other treatments that will help these patients, and putting them in jail where they're not getting the treatment that they deserve does not do us any good down the road.
Jail, and I know firsthand, is no place for mental health recovery. So the Sheriff's Association came out that 50% of officer-involved shootings have to do with a mental health crisis. What we're training here stops a lot of what we're reading about every day in the newspapers.
Miami-Dade in the city of Miami handled over 10,000 cases with very few arrests. But I also have to mention, as a result of this training, police injuries have almost stopped. Police shootings of people with mental illnesses has almost stopped. We went from 1 shooting a month in this community, someone with mental illness, to maybe 4 or 5 in the last 7 or 8 years. It's all due to the great credit of our law enforcement who have really already stepped up in our community.
You will not find a sheriff in this state or in this nation who is not struggling with the growing population of people who are mentally ill in our jails. This is not a new problem, but it is becoming an even bigger problem.
As your sheriff, I can tell you that for the last 3-4 decades, I've been running the largest mental health hospital in the state of Kansas.
And it is wonderful to see this group of people here today on a national effort to address it, and we in California being part of it.
San Diego, we're responding to this challenge with a very strong collaboration with our criminal justice and behavioral health partners, because we know firsthand the importance of utilizing data-driven practices to reduce recidivism and promote recovery. We know that screening and assessment gives us information about risk and needs in order to safely supervise people in the community and give them the best chance for future success.
It's a shame that county jails by default becomes the nation's mental health institutions. We should do better, we must do better, we deserve better.